I'm Thomas Baldrick. We are happy to have back with us Dr. Mardi Gomberg-Maitland, Director of Pulmonary Hypertension Program at the University of Chicago. Thanks for stopping by.
Thanks for having me.
All right, so you presented a poster on sarcoidosis-associated pulmonary hypertension. What can you tell us about this study and some of its findings?
Sure. So, for over a decade, we've been using pulmonary arterial hypertension medications in sarcoidosis, but there's really little literature to attest its efficacy. And we thought we should show everybody that there really is good results with PAH therapies. So initially we sought to look at patients on prostacyclins who have sarcoidosis and a predominant pulmonary vascular disease component and see how they fared. And what the study really developed into was really looking at all of our patients on all types of pulmonary arterial hypertension medicines, so all the oral agents and the infused agents, and then doing a comparison cohort to patients that are seen in our interstitial lung disease clinic who have sarcoidosis, looking at their CAT scans, making comparators, seeing if survival is altered or the same with pulmonary hypertension.
So this is pretty comprehensive, over 10 years and all that.
Yeah, and I'm fortunate to be at a place that has a very strong pulmonary hypertension program and a strong interstitial lung disease network program. And so we had all the data. It was just really getting both teams to work together. And what we found is that patients who have a pulmonary vascular disease component do well with PAH-specific therapies, even prostacyclins. So the fear is that patients with sarcoidosis have a lot of interstitial lung disease and that they might get too much ventilation perfusion mismatch because they have interstitial lung disease and vascular disease, and if you increase perfusion, you might actually get more hypoxemia. But we didn't find that. And we found that they had better oxygenation when they were walking and at rest, and it didn't affect the course of their sarcoid. So all in all, we found that PAH therapies really do work with patients with sarcoidosis.
How common is sarcoidosis-associated PH in the United States?
Yeah, so it's difficult to pinpoint the epidemiology because sarcoidosis can you can get pulmonary hypertension that fits multiple groups. So you can get pulmonary arterial hypertension with vascular disease. You can get PH from left heart disease because these patients often have hypertensive heart disease, and you can get sarcoidosis of the heart itself, causing diastolic compliance issues and backflow and pulmonary hypertension. And then you could have interstitial lung disease. And then to top it all off, these patients seem to be hypercoagulable and they can get pulmonary embolus. So you have really all four groups involved in the classification of pulmonary hypertension, and I think that's why we've put it into group 5, which is systemic multiple factors. And it's tricky because I think that the ones that have the best prognosis would be the pulmonary vascular disease because we actually have therapies, but it's really hard because it's very rare that they have only pulmonary vascular disease. So when you ask me how common is it, I think it's quite common to have some element of pulmonary hypertension, but true pulmonary vascular disease, a little bit less common.
What are the main safety concerns based on what you've discovered with this study?
The main safety concern would be to give these therapies to patients that have solely interstitial lung disease without any vascular disease, because our therapies actually can hurt them. You can cause more hypoxemia. You could elevate the left-sided pressures and cause pulmonary edema. And so you really don't want to do this without having done a right heart cath and even a left heart cath to make sure you're treating pulmonary vascular disease.
So now that you have this research in place, how do you continue it, or where do you build upon it?
I think that the next step would be to get folks to do more trials in patients with sarcoidosis. A few years back, people were a little bit more eager to do it, and I think that because it's difficult to find the right patients, people have stepped back a little bit, but I think now with our study, it's clear that these patients can benefit, and hopefully there'll be more research in it.
Very good. Thanks for stopping by and spending some time with us. Always a pleasure.